Well, the increase in COVID-19 cases, hospitalisations and deaths have led to increased calls from some quarters for more restrictions. Some provinces have said they are on a third wave, but that hasn't been called for the entire country yet. In the latest 24-hour reporting period, there were 3,084 new cases. So is a lockdown looming, and how strict should the new measures be? For a review, we're joined by the former Chief Ministerial Advisor on COVID-19, Professor Salim Abdool Karim is the Director of CAPRISA, the Centre for the AIDS Programme of Research in South Africa, and also, of course, working now with the World Health Organization. Professor, a great pleasure to have you with us as always. Just looking at the latest numbers, 3,000 or so new cases. The other day, I remember it was 4,000 or so. But I guess we shouldn't look at these little swings. Nobody's saying things are getting better. And there are other indications, like the 17% increase in hospitalizations. How bad are things in your view?
It's a very good evening, Francis, and good evening to all of the viewers. When we look at the way in which the epidemic has been unfolding in our country, there's a period of roughly about 3 months between the first and second wave. And between the second wave and the current increase in cases is also about 3 months. It's close on to about 100 days. So we are expecting to get a third wave, and we're expecting it to hit its peak towards the end of June. So we know that the way in which a wave unfolds is that it takes a foothold in 1 or 2 provinces initially. In the first wave, it started off in the Western Cape. In the second wave, it started off in the Eastern Cape. In the third wave, it seems to have started off in between the Northern Cape, Free State, and Gauteng. We are, in effect, in the third wave, or entering the third wave, if you want to look at it like that, although parts of the country are well into the third wave. And the indicator for that is that we've crossed the threshold for low transmission, which translates roughly to around 3,000 cases per day, and that's on a 7-day moving average. We've crossed the positivity rate, and we have maintained a high number of tests, which is very important. We've got to be looking at increasing our daily testing. We're now at about 34,000.
And this positivity rate is so important. It was mentioned by the health minister. I think we're around 10. The ideal is around 5. Just explain what exactly that tells us.
So one of the challenges in just basing an estimation on the number of cases is that the cases are dependent on the amount of testing you do. So if you don't do a lot of tests, you don't get a lot of cases, even though there may be a lot of cases. So one of the ways you adjust or deal with the variability in testing is that you look at, instead of the number of cases, you look at the proportion of tests that come back positive. Now, the WHO has set a benchmark of around 5 as the target to have. In other words, you have 1 test positive for every 20 that you do. And they say, and they provide it just as a guide, that when you get to more than 10% of your tests being positive, then you need to be more concerned, and you need to increase testing, but also you need to know that you are now entering a surge. And that's where we are. We are, if you look at the 7-day moving average, we are around the 10% mark. And so all in all, you look at 3 indicators: the number of tests that we're doing, the positivity rate, and the number of cases. We look at admissions only later because there's a lag. Admissions take a little longer before they rise. So those 3 markers, by those 3 markers, we are in the third wave.
Yeah. And the test positivity rate suggesting we're missing a lot of cases, that the prevalence is higher in the population. And I mean, this has always been the suspicion that South Africa missed cases in the first 2 waves as well. People looking at excess deaths to suggest that maybe those people who died, it wasn't declared, but they had COVID. How serious do you think it has been for the country, official figures versus what you think has actually been going on in the first two waves?
So we have to draw the distinction between the number of people who were infected and the number of cases. So when we want to measure the number of people who've been infected, we do a different test. It's called an antibody test. And using antibody tests, we measure seroprevalence. When we measure seroprevalence, we get some idea of the total proportion of the population that's become infected. And based on the data that we got from our first and second waves, and combining the various seroprevalence estimates, roughly for every case that we know about, that is reported, tested and reported, there are about 9 cases that we don't know. And those are individuals, most of them are just individuals who are asymptomatic or mildly symptomatic that they're not caring about. So those individuals we will simply never be able to find because of they don't have symptoms. Now that's the case in every country, but the older the population, the lower the proportion. So for example, it's been estimated in Spain that about half of the cases are not known. So for every case they know, there's another one that they don't know. In our case, because of the younger population, more of the people have asymptomatic infections. So roughly every case we see, there's about 9 others that we don't know about. That's what makes this virus so difficult to control.
Yeah.
There's so much more. We're just looking at the tip of the iceberg.
But Professor, that actually gave some people hope because the idea was that there would be this immunity building over time. Ironically, even the food lines were blamed for spreading the disease, so the lockdown measures. But because of that, it was hoped that the second wave would be better than the first or less lethal because many South Africans would be immune. And the third would be even less lethal. Now we have these variants. We have the Indian variant as well, or the one that originated in India. Does that mean we simply cannot tell? I mean, what are your expectations, your fears around a third wave?
You're raising a very important issue because if you remember after the first wave, there were some scientists and people claiming, oh, South Africa has reached herd immunity. We won't have a severe second wave. 37% or 27% of the population have antibodies. Well, we're learning that the hope that people could get infected naturally and that would protect them from getting future infections, we learned that that is false hope, in that individuals who've had past infection are not fully protected, especially when you have a new variant. And it turns out that the variant, the 501YV2, or what is also called the B1351, the variant that we first described here in South Africa, that when that variant is causing infection, that past infection or past immunity does not protect fully against that virus. So many individuals who were infected in the first wave got infected again in the second wave, and we saw this, the case of reinfections that were occurring. So there is no strategy that makes sense from what we know now to let natural infection protect people. We now have a better understanding that we actually need to vaccinate people and we need to use our prevention toolbox in order to prevent them from getting infections.
All right, and that isn't happening fast enough. Professor, in a few seconds, if you don't mind, what does this mean? Should we ban alcohol? Should we increase the lockdown level to 2 or 3? Do you think we should start acting?
So the Ministerial Advisory Committee, I gather, has provided some advice. I'm not familiar with what they have recommended, but if it was left to me, I would say that we need to basically do 3 things. The first is that people have become complacent. And so we need to raise the alert level so people understand that the situation is no longer level 1, that we are now in a situation that's different. And I think that's important to send that signal. The second is that we have to do something about reducing the size of gatherings, because that can speed up the transmission by creating super spreading events. And the third is we need to go into gear to prepare our hospitals for the coming surge. And so those three things involve a set of recommendations that we're quite familiar with. Now that we've dealt with 2 waves, our country, we know, what things work and what things don't work.
All right, Professor, thank you for your views tonight and explaining a lot of the science to us. Again, Professor Salim Abdool Karim, currently Director of CAPRISA.